What if you were infected with a disease right now? A disease that gives you no pain, no fever, no visible signs, and no immediate discomfort, yet quietly damages your body, threatens your fertility, and spreads to others without you ever knowing. This is not fiction. This is not fear-mongering. This is reality. This disease is called chlamydia. Chlamydia is one of the most common sexually transmitted infections on Earth, and at the same time, one of the most dangerously ignored. Every single year, tens of millions of new chlamydia infections are reported globally, and experts believe the real number is far higher because so many cases are never diagnosed. Why? Because chlamydia is silent. Most people who have chlamydia feel completely normal. No warning signs, no alarms, no reason to panic, at least not at first. But while people go about their daily lives, the infection continues to spread, damage tissues, scar reproductive organs, and silently destroy futures. Chlamydia does not choose based on age, education, wealth, or nationality. If you are sexually active, you are at risk. This video is not meant to shame anyone. It is not meant to scare you. It is meant to inform, empower, and protect. In today's video, we will uncover the full truth about chlamydia, what it really is, how it spreads so easily, why so many people never notice it, the serious and sometimes irreversible damage it can cause, how it is treated, and how you can protect yourself and others. Stay with us until the end, because this information could protect your health, your fertility, and your future. What is chlamydia? Chlamydia is a sexually transmitted bacterial infection caused by a bacterium called Chlamydia trachomatis. Unlike some bacteria that live freely in the body, this bacterium is an intracellular organism, meaning it lives and multiplies inside human cells. This makes it especially dangerous. Chlamydia primarily infects the cervix and uterus in women, the urethra in men, the rectum, the throat, and in rare cases the eyes. Because it hides inside cells, the immune system often fails to detect it early. This allows the infection to persist for months or even years without noticeable symptoms. Chlamydia is not a virus. It is a bacterial infection, which means it can be cured with proper medical treatment. However, untreated chlamydia does not disappear on its own. Instead, it slowly causes inflammation, tissue damage, and scarring. That is why chlamydia is often described as the silent infection, the hidden epidemic, the disease you don't feel until it's too late. Understanding what chlamydia is the first step toward protecting yourself. How does chlamydia spread? Chlamydia spreads primarily through sexual contact. This includes vaginal sex, anal sex, oral sex. It can spread even when there is no ejaculation, there are no visible symptoms, the infected person feels completely healthy. The bacteria are transmitted through semen, vaginal fluids, rectal fluids. Chlamydia can also be passed from an infected mother to her baby during childbirth. This can cause eye infections, lung infections, serious health complications in newborns. What chlamydia does not spread through: kissing, hugging, sharing food or drinks, toilet seats, swimming pools. Another critical fact many people do not know: you can get chlamydia again even if you've had it before. There is no natural immunity. This makes regular testing and prevention absolutely essential. Symptoms of chlamydia. One of the most dangerous aspects of chlamydia is that most people experience no symptoms at all. This is why it spreads so easily. However, when symptoms do appear, they may vary between men and women. Symptoms in women: abnormal vaginal discharge, burning sensation during urination, pain during sexual intercourse, lower abdominal or pelvic pain, bleeding between periods, bleeding after sex. Many women mistake these symptoms for urinary tract infections, hormonal changes, menstrual irregularities. As a result, chlamydia often goes untreated. Symptoms in men: burning or pain during urination, white, cloudy, or watery discharge from the penis, testicular pain or swelling, discomfort in the lower abdominal. Rectal chlamydia: rectal pain, discharge, bleeding, itching. Throat chlamydia: mild sore throat, often no symptoms at all. Because symptoms are mild or absent, testing is the only reliable way to know if you are infected. Dangerous effects of untreated chlamydia. If chlamydia is not treated in time, the consequences can be severe and permanent. In women, pelvic inflammatory disease, PID, chronic pelvic pain, scarring of fallopian tubes, infertility, increased risk of ectopic pregnancy, life-threatening. Many women only discover they had chlamydia after they struggle to become pregnant. In men, epididymitis, painful inflammation near the testicles, reduced sperm quality, fertility problems, chronic pain. In both men and women, increased risk of HIV infection, chronic inflammation, reactive arthritis, joint pain, eye inflammation. In babies, eye infections leading to blindness, pneumonia, serious breathing problems in newborns. The most tragic part? All of this is preventable. With early testing and treatment, these complications can be avoided. Treatment and medical care.
The good news is clear. Chlamydia is curable. Doctors typically treat chlamydia with oral antibiotics, usually taken over a specific number of days. Key treatment rules. Take all medication exactly as prescribed. Do not stop early, even if symptoms disappear. Avoid sexual activity until treatment is complete. Inform sexual partners so they can be tested and treated. Failure to treat partners often leads to reinfection. After treatment, follow-up testing may be recommended, especially for high-risk individuals. Self-medication is dangerous and ineffective. Only proper medical diagnosis and treatment can fully eliminate the infection. Prevention. How to protect yourself. Prevention is the most powerful weapon against chlamydia. Here's how you can protect yourself. Use condoms consistently and correctly. Get tested regularly if sexually active. Limit the number of sexual partners. Have open conversations about sexual health. Get tested before starting a new sexual relationship. Seek medical help immediately if exposed. Education reduces fear. Testing reduces spread. Awareness saves lives. Final message. Chlamydia is not just a medical issue. It is a public health issue, a relationship issue, and a personal responsibility. Feeling healthy does not always mean being healthy. Silence does not mean safety. There is no shame in testing. There is no weakness in seeking treatment. There is only strength in protecting your future. If this video helped you, share it. Start conversations. Encourage testing. Because silent infections lose power when people speak up. Stay informed, stay responsible, stay safe. Your health matters.